What causes abnormal eye tracking? Have you ever noticed how your eyes move when you follow something in motion? Now, imagine if those movements were not as smooth or accurate. This is what we refer to as abnormal eye tracking, and it can be particularly relevant in understanding schizophrenia. So, what causes these irregularities in a movement? Abnormal eye tracking is often seen in individuals with schizophrenia. It is linked to differences in brain function and can be a symptom of the disorder. Eye movements typically include smooth pursuit, where the eyes follow a moving object, and saccades, which are quick jumps from one point to another. In schizophrenia, these movements can become disrupted. People with schizophrenia may struggle with smooth pursuit movements, showing less accuracy and making more mistakes. Their eyes might not follow moving objects as they should. Additionally, when performing antisaccade tasks, which requiring looking in the opposite direction of a reflexive glance, they often experience delays and inaccuracies. This indicates a challenge in controlling and monitoring eye movements. The reasons behind these abnormal tracking patterns are varied. One major factor is neurological differences. Schizophrenia involves changes in brain areas responsible for controlling eye movements, such as the frontal eye fields and the optic tract. These areas may not function as they should, leading to unusual eye movement patterns. Genetic and environmental factors also play a role. Both inherited traits and life experiences contribute to the risk of developing schizophrenia and its related eye movement issues. These factors can affect the neural circuits that help control attention and eye movements. Another aspect to consider is the effects of medication. Some antipsychotic medications can lead to involuntary eye movements or blurred vision due to issues with muscle coordination. While these side effects can affect eye tracking, they are separate from the core neurological challenges associated with schizophrenia. Attention deficits are another key factor. Individuals with schizophrenia often face difficulties with attention, which can influence how they visually scan and process information. This can lead to restricted eye movement patterns, such as a smaller area of focus when looking at faces or social scenes. In practical terms, abnormal eye tracking can serve as a marker for schizophrenia. It can help distinguish those with the disorder from healthy individuals and may identify those at higher risk for psychosis. Assessing eye movements can aid in early diagnosis and monitoring treatment effects. To sum it up, abnormal eye tracking in schizophrenia arises from a mix of brain function differences, genetic and environmental influences, and medication side effects. These factors disrupt normal eye movement coordination, contributing to the visual and attention-related symptoms seen in schizophrenia.